The doctor said that I'll be done some tests and it became positive. And that's where we started chemo.
Maisha ya Hope Wamboi mwenye umri wa miaka 11 yalibadilika ghafla mwezi Novemba mwaka jana alipougua saratani ya mifupa. Hali hiyo iligunduliwa na madaktari baada ya wazazi wake kugundua uvimbe kwenye paja lake na kumpeleka hospitalini.
I was extremely shocked because since in our family line there has ever been someone who had cancer before. She underwent 6 cycles of the chemotherapy. It was not easy because for the first 3 days she had to be admitted in the hospital. Then after 3 days we had to go home after she was discharged. Then for the next around 3 days things were not that good because even taking fruits was a real problem.
Aidha, matibabu hayo hayakuwa suluhisho tosha, kwani hali yake ilidorora na kumlazimu kukatiza masomo yake wakati huo akiwa darasa la 4.
If we don't do the amputation at this stage because the cancer has not moved, within 2 years our daughter will be normal. Yeah. So we had no more choice.
I was shocked, but I didn't. I just stayed and I just accepted that.
Baada ya matibabu yaliyowagharimu wazazi wake takriban shilingi 900,000, Hope alipona saratani mnamo mwezi Julai mwaka huu. Kwa sasa angali anasubiria kuwekwa mguu bandia kabla ya kurejea shuleni.
I'm so excited that I'm going back to school. My friends have supported me very much because even they bring me homework I do and the teachers are so happy.
The number one childhood cancer is leukemia.
Daktari Jesse Raduma anayehudumu katika hospitali ya Texas kitengo cha matibabu ya saratani anaeleza baadhi ya saratani zinazowaathiri watoto wachanga.
The other types of cancers that we see commonly in children include brain and spinal cord tumors. Again, there's a variation in terms of age, where we see leukemias commonly occurring between 3 to 5 years of age. Then there are other types of cancers like bone cancer, the primary bone cancer, osteogenic sarcoma, are seen more commonly in older children or the teenagers.
Hata hivyo, kuna hofu kuwa baadhi ya aina za saratani miongoni mwa watoto hujificha na kuonyesha dalili za maradhi mengine, na wengi huishia kufika hospitalini kuchelewa.
Parents need to be on the lookout for common symptoms such as unexplained weight loss. When your child is having a fever that is not attributable to any cause or has been treated recurrently for infections, then healthcare provider as well as the parent need to be a bit worried. The other common presentation include bone swelling, bone pain. A child would present with a lump or a mass in the chest, in the abdomen, in the pelvis or in the armpit. We can also have children developing white reflex or white light in the pupil. When you look at the eye of the pupil, you see there's a light that is coming out from the eye. Then sometimes you might develop visual loss or swelling of the eye.
Ni yepi yanayopelekea mtoto mchanga kuugua saratani?
When you have a strong family history of cancer, then we talk about possible genetic mutation in the family that can be heritable. So that is one of the common causes of this cancer. The other one is environmental factors. So exposure to ionizing radiation, which can be both accidental or medical exposure. Exposure to chemicals like diethyl stilbestrol or some of the chemotherapeutic agents that we give these patients.
Daktari Raduma anaonya kuwa mtoto anapopona saratani ni muhimu kuendelea na uchunguzi wa matibabu, kwani kuna hatari ya kuugua saratani kwa mara nyingine maishani mwake. Humu nchini Kenya, takriban watoto 3,000 huugua aina tofauti za saratani kila mwaka, na 10% ndio wanaopata nafuu kikamilifu.
The primary reason why most of these children do not do well, as per a report that was done by WHO, is malnutrition actually. So some of these children normally come from a very poor background, and on top of having a challenge accessing treatment for the cancer, they also have challenges with feeding and malnutrition.
Hope ni mmoja wa waliopata nafuu, na sasa wosia wake kwa wanaougua saratani ni huu.
Even though it's a long journey, we can survive if we trust. Because if you believe you're a conqueror, you will survive.
Ili kupunguza uwezekano wa kugundua kuchelewa ulivyoathirika na saratani, madaktari wanashauri huo ukifanywa vipimo vya matibabu mara kwa mara. Ben Kirera, K24, makala ya SIHA Yangu.